who would you recommend, or for this study, at what age?
Right. Well, I think that, when you're looking at risk factors and you're talking to the patient, the most important thing is family history. Because ultimately all diseases are genetic. I mean, really. You get a lot of good things from your parents, but one of them may be coronary artery disease. So if you have a family history of coronary artery disease at a young age, where your mom or dad had a heart attack at age 30 or 40, then I think you should get the scan earlier. But if you're making a general recommendation, then I recommend men get it at age 40 and women at age 45. Okay, I mean, women tend to get just as much heart disease as men, but they tend to get it a little later in life, like 5 or 10 years later in life compared to men. So if you look at the curve of, mortality from coronary disease, it peaks at about age 70 in men and about 75 in women. So there's a slight difference there.
So I agree with you. I mean, we get EKGs for surgery, usually men in age 40, women age 45 or 50, because we know that's when when it starts to rise, you're going to have silent heart disease. So the next question is, suppose somebody has multiple risk factors. And when I say multiple risk factors, smoking, does not accelerate it, or diabetes, and these other coexisting diseases that we know tends to bring on coronary artery and vascular disease much earlier than your natural genetics would do.
Well, if a patient comes to me and he's a smoker, then I jump all over that guy. I mean, I tell him, look, I love you. I'm going to be your doctor no matter what happens. But if you don't stop smoking, you're going to die. Okay.
I'm going to kick your butt.
Yeah. I mean, you're not going to do well. I mean, so almost virtually every disease known to man is going to be tripled in the setting of a smoker. But in any case, yeah, I individualize the recommendation. It depends on the specific patient. But in general, we like you to get screened at middle age. Now, when you come in, you're either going to have a score of 0 or you're going to have a score other than 0. Now, whatever your score is, it's fine. Whatever it is, it's manageable. And then after that, the goal of therapy is to halt progression of the disease. I mean, if you have a score other than 0, you have coronary artery disease, okay, period. And if you have a score other than 0, what we're going to do now is try to halt or slow the progression of the disease. Actually reversing the disease.
That was one of my later questions. Is it possible?
I think it's possible, but it would really take a religious commitment.
You would have to become a fruitarian, vegetarian?
I don't know about a fruitarian, but you've got to go animal fat free. You have to, get in shape. You have to exercise. And there are a few supplements I think are helpful.
Actually, we're going to ask you about those later.